Hi, I'm Valerie, and I'm going to talk to you about carcinoid syndrome. In October of 2015, I was diagnosed with carcinoid syndrome. Like many patients, I struggled with symptoms for years, but it was this racing heart, the tachycardia, that sent me to the cardiologist to try and figure out what was going on. He did all the cardiac tests. Everything turned out great. There's no problems there, so I was grateful for that. But what was it? Well, he did a 24-hour urine test, the 5-HIAA, and it came back elevated. That's what started me on my neuroendocrine journey. I was able to find a doctor that was able to think outside the box and help me to manage this. I didn't have a biopsy-confirmed diagnosis from a tumor, so he said, let's just try the octreotide and see if that doesn't work for you. So I tried it out. I did self-injections, which I thought I'd never be able to do. Having to stick a needle in my abdomen, that wasn't going to happen. But I did it. I was very grateful for it. It gave me quality of life. I felt so much better. I stopped the tachycardia. I had some energy. I didn't have to make as many trips to the bathroom. So I was very grateful for this medication and very grateful for a doctor who decided to at least give me a trial on it. Then I was put on the Sandostatin LAR, the long-acting. That worked well. I didn't have to do as many injections, and then I was switched to the lanreotide. That is what I continue to take today. I take it every 21 days rather than the typical 28. I still have to do rescue shots every day. Some days are worse than others, but it helps me to control my symptoms, and it also helps to give me quality of life. Now, these injections can be delivered one of several ways. You can have a vial that you fill up a syringe with, and you can give yourself injections that way. You can get the pre-filled syringes, which is what I prefer. And those I can just throw on my purse and take with me. A lot of people are looking at the pen, which is pre-filled and can stay unrefrigerated for 28 days. So there's different options for you. A lot's going to depend on what your doctor can prescribe for you, and it also depends on what your insurance will cover. So please take a look at both of those things to determine the best solution for you. Not everyone needs rescue shots, so that's great. But if you do, it's good to know that you do have options available to you. Some NET patients also can be sensitive to drugs ending in INE. For many years, I struggled every time I had to get a cortisone injection, went to the dentist where I got the Novocaine. I would just kind of check out. I'd feel horrible. I'd have nausea. Just didn't know what was going on. I'd struggle to breathe. And then it would kind of resolve itself after time. But why was this happening to me? Well, after my carcinoid diagnosis, I determined that's what was going on. So that's what also helps with the rescue shots. When I get these symptoms, it will help with that. It takes about 5 to 10 minutes, and it gets resolved, and everything is fine. NET patients who have functional tumors need to be aware of the 5 E's. 5 E's that set off a syndrome attack could be epinephrine, exercise, emotion, eating, and ethanol, which is the alcohol. Exertion like heavy vacuuming, heavy lifting, anything that causes any type of true exertion will also set off my syndrome. So that's why I am very grateful for my cleaning lady. She takes care of all the heavy lifting and exertion for me, so life is good. But not everyone gets this, so you can't justify the cleaning lady all the time, but it does work for me. Everyone is different. Some people get the syndrome attacks, some don't. I know of a number of patients that don't have any issues with that, but some that do are very grateful for the rescue shots. Random itching can also be a problem for NET patients. Hydroxyzine works well for me. I take it at night. If I have additional itching during the course of the day, I can take another one. Zermello has been known to help a lot of patients that have the diarrhea. Both of these medications are under a doctor's prescription, so make sure that you do check with your doctor to make sure that it is the right medication for you as well. It can be adjusted depending on how much you're suffering with the symptoms. Constipation can also be an issue for a lot of patients. I've been taking magnesium capsules for many years, even before my diagnosis, because I struggled, didn't know what it was between the diarrhea, the constipation, and I've been taking the magnesium tablets at night or taking the magnesium capsules at night. That seems to work very well for me because I can also adjust it. If I'm having more diarrhea, then I back off on the magnesium. Some patients take the Miralax, some take the stool softeners, but it's most important that you do discuss this with your doctor and get the right combination that works best for your particular situation. Rest when you need to. Give yourself grace when you struggle to do even the simplest of tasks on a daily basis. We all have different experiences, but I was very grateful to find LACNETS in my early diagnosis. They have been tremendously helpful for me as far as seminars, getting me in touch with certain experts, online support. They do have a Net Connect Buddy program so that you can be connected to another patient that has similar symptoms to you and may have certain diagnosis that is pertinent to what your situation is. So I would highly recommend getting on lacnets.org and seeing for yourself what they do have to offer. Talking to others who experience the same symptoms has been very helpful. Listening to experts in that field has helped give me hope and comfort. And we just want to let you know you're not alone in your journey. We're here to help you. Thank you.